Hello everyone. Just to provide an update on our last board meeting, which happened this last Wednesday. We had a really packed agenda with a lot of ground to cover. I just wanted to extend before I start thanks from the board to all staff for all of the hard work that you have been doing over the last few months, and particularly the period since Christmas, when we have seen a significant rise in attendances through our emergency department and admissions to the ward. Special thanks go out to the infection control team who've been working tirelessly to deal with outbreaks of infection around the hospital really successfully, and getting those under control and ward areas back open as soon as we can. At the board this month, we had a real focus on our digital strategy, and it was really fantastic to talk about the progress that we've made over the last year. We've clearly implemented the Track Care system, and the new telephony system has gone live this week. But we've also made massive progress in our online booking capability and our ability for patients to check in digitally as they arrive in the hospital, with all sorts of benefits around the data that we're capturing, which enable us to better predict demand within the hospital and improve the quality of care that we provide. The priorities going into the new year over the next 12 months are going to be to move to a single sign-on programme, to roll out the clinical functionality within Track Care, and also working with our colleagues across Somerset to develop a shared record, which I think would be a major transformation for us. We had the Chief Officer of Somerset CCG, Nick Robinson, join us for the majority of the board meeting. It was great to have Nick there to reflect with us on the CCG strategy for the coming 5 years, and how YDH sits within that, and how we can work with colleagues both in the CCG and at Musgrove Park and Somerset Partnership to shape that strategy for the future. So a major focus for the board over the coming year will be to continue to work with the CCG to develop that. We were really pleased to receive a report, a really positive report, following a review of our neonatal services, which were incredibly positive, both about the quality of the care provided, but particular praise for the new facility that we've got. So that was really great to hear that. And also strengthening and great performance around the operational management of the hospital. I think I put out a message earlier in the year sharing the strong performance against the 3 key national targets. We're consistently in the top 5 in the country for our A&E performance, doing really well against our referral to treatment times, and our cancer targets, so that we have had some challenges around that, are pleased to say are now coming back online, and we'll be achieving those as well. So that's really positive. Our money remains our biggest challenge, but we are on track to hit our control total for our revised forecast control total for this year. We also received a report from our Freedom to Speak Up Guardian, Linda Han, and we also have a second Freedom to Speak Up Guardian, Fiona Rook, which was really great, and talking about the work that they're doing. And if you don't know about Freedom to Speak Up Guardians, what they do, what their roles are, I'd encourage you to get a bit more information on that. They're there for you to raise any concerns that you have across the organisation. So get in touch with Linda or Fiona if you want to do that. And finally, the board had a conversation about Simply Serve. Staff will be aware that Simply Serve went live yesterday on the 1st of February. Wanted to make it really clear that what we're keen to make sure as an organisation and as a board, that Simply Serve remains an essential part of YDH, and the relationships with colleagues within the new organisation should remain unchanged as part of the transfer. If you're a member of the Simply Serve team, you are a really valuable part of YDH, and we need to you to continue to work in that way, with the eye care values at the real heart of what you do. So we want to maintain that dialogue over the coming weeks, and are keen to hear from you around the transition process. Those are the main points of the board, and I look forward to speaking to you again next month.